I'm Megan Golden, the CEO of Mission Cure, and I'm here with Dr. Kristen Roberts from the Ohio State University. She will introduce herself, but she gave a presentation about screening for vitamin and nutrient deficiencies in pancreatitis patients. And one of the things she mentioned is that if you go to the drugstore and look for supplements, a lot of them are actually not going to give you what you need to address a deficiency. So we persuaded her to come to the drugstore with us and take a look and see how we can check out what's there.
Thanks for having me do this. I have an interest in fat soluble vitamin deficiencies and just trying to figure out the best way to streamline recommendations for patients. And I have found that just telling somebody to take an over the counter supplement and giving them a dose is pretty insufficient. And there's a lot of reasons for that. So that's what we are checking out what is available in this pharmacy. All right. So just coming here, you could see we've got rows and rows and rows of supplements. So the first thing we are doing is just looking for some of the fat soluble vitamins. Now, the easiest one to find is always vitamin D. And it's the first one that jumped out right when we got here. You get this whole section just on vitamin D. So once I find the vitamin D, the next thing I'm doing is trying to look to see if the dose that I've been prescribed is available. So you can see here, it looks like it looks like it goes up to 10,000 IUs, which is a pretty good dose. But it depends on what your provider has recommended. So let's say this is the dose that I needed. Then the next thing that I do is to look if this supplement has been third party tested, because a lot of supplements, even brand name supplements, can be on the market and they may not have been tested for their bioavailability. And in a condition like chronic pancreatitis or acute pancreatitis or pancreatic cancer, you want a good bioavailable supplement. So the most common way that you can tell is by an organization called the United States Pharmacopoeia. Their abbreviation is USP. I don't see it on this label. So that doesn't mean that this is not a good supplement. It just means I got to try other websites to see if this has been tested. So consumerlabs.com is an option. And then NSF has a website as well that they will publish a list. So if I was in a hurry, I would not buy this supplement because I don't have time to look it up online. So I'm going to look for another vitamin D supplement. So a lot of nature made supplements are USP certified. So that's what the logo looks like. But if we look at some other nature made brands, like I'm just pulling out this calcium one, you can see this one doesn't actually have the USP certification on it. So it's not brand specific. You have to look for it. I personally just think USP is the easiest way to find a supplement that's been tested. So this ensures you that what it says on the supplement label is actually able to be readily dissolved in your gastrointestinal tract and hopefully get absorbed. So if I needed this dose of 2,000 IUs, I could do that. Probably not going to treat a deficiency. It's pretty low to treat a deficiency, but it might be able to prevent one from occurring, depending on what the recommendations were from your provider. It does look like they have a 10,000, which is higher, but this one does not look like it is USP certified. This one has vitamin D and vitamin K in it, which is a great combo, and it does have a USP on it. So if my doctor told me I needed both vitamin D and vitamin K, this one could be a good option. It's got 5,000 IUs, but depending on the dose, you might need to take a bunch of these.
Is there any difference between D3 and vitamin D?
So vitamin D, you can get it in D2 or D3. Most supplements are going to be in D3. So this is what you're going to find for an over-the-counter supplement. So one other thing while we're talking about these supplements is that oftentimes if you're experiencing exocrine pancreatic insufficiency and you have trouble digesting and absorbing fat, we will often recommend that patients take a water miscible form. So water miscible just means that it's not going to require all the same enzymes to be able to get that nutrient into the cells in your intestine. And it would say that on the label, and none of these say that they're water miscible. So even if we found a USP certified and it was in the right dose, I would want to also talk to my provider to see if they wanted me to take something that was water miscible, because it might be that that's going to be the best way to replete my deficiency.
Kristen,
Yeah.
if your provider gives you a prescription for a supplement, does that mean it will pass all these tests?
It'll pass all these tests, yes. Except for the water miscible, that has to be specifically included in the order. I only know of one brand off the top of my head that has water miscible forms. We often use it in cystic fibrosis, but you can always talk to the pharmacist. Like, we're at a retail pharmacist, there's a pharmacist right there. They will know how to help you look up these questions if you have them or if you forget. But prescription grade, I encourage providers to write prescriptions if they're treating a deficiency. If they're trying to prevent you from getting a deficiency, over the counter supplementation that's USP certified and an appropriate dose is a good way to go.
Can we just look for one or two other of the fat soluble vitamins?
Yeah. So we saw that one that had K in it. Here's vitamin E. All right. So vitamin E is a fat soluble. This one is USP certified. And the dose is a pretty typical dose that we would use for treating actually a deficiency. So this one might be appropriate to use. You just have to look at what your physician prescribed. And it looks like they even have a higher dose, which I don't think I've ever seen this high of a dose in a pharmacy yet. And that one is USP certified also. So vitamin A is more challenging to find, and likely the reason why this one is harder to find is because you can really hurt yourself by overdoing vitamin A.
I think I found it.
Okay, so here is a vitamin A supplement. It's 2,400 micrograms, and it's retinol palmitate. You can see that there's no USP certification on this one. So I would not take this unless it was third-party tested. This is probably the highest one I've actually seen. Again, so this pharmacy is doing a good job of having variety, but it would be nice if it was USP certified or third-party tested.
Question for you, because I think you were just about to say something about vitamin A being harmful. So people shouldn't just go out on their own and get these, right?
Correct. Vitamin A can be pretty toxic, particularly for pregnant women. And so you definitely don't want to take high doses of vitamin A without having a recommendation to do so. And this is the reason why it's hard to find. Like I said, I haven't seen this high in a pharmacy, an over-the-counter pharmacy, in a while. And I think that's liability. You get a little bit nervous that somebody's going to take too much of that. Too much of a good thing is usually never a good thing, right? So one of the things I was looking for was, like, in this specialty section, sometimes they'll have supplements that are geared towards eye health, and vitamin A is important for eye health. So sometimes you might see a vitamin A included. Like, this one has lutein in it, which is a carotenoid, which is a precursor. So this one has vitamin A, but it's as a precursor. So again, not something I would take for treating a vitamin A deficiency. It's not USP on it either. But some of those eye supplements can kind of draw you in. If you have a vitamin A deficiency and then your doctor's told you that they can see something wrong with your vision or a BTO spot or something like that, sometimes patients are drawn to want to buy those supplements, and they're unnecessary.
Here's fish oil. Is that good for you?
So this particular fish oil supplement, you can see no USP on it. I have no problems with people taking a USP certified fish oil supplement, but this is something you want to talk to about your doctors, because it can impact coagulation. So if you're on any type of blood thinners, you'd want to make sure that your doctors know that you're on that. And a fish oil supplement will not prevent essential fatty acid deficiency. So if that's something that you've been talking about with your providers, that's not going to be enough. It only has omega-3s and not omega-6, and both of those are essential.
Is there a problem with taking too much vitamin D?
So you can get hypercalcemia from taking too much vitamin D. So you don't want to just pop that one for preventative sake if you don't know what the dose is that you're taking. And
And I was just talking to one of the pediatricians at the conference, and she said sometimes they'll see that in pediatrics where they find a higher dose vitamin D and they're taking it every day, and they can see elevated calcium levels. And calcium works as an electrolyte, so it impacts muscle contraction, so it can impact your heart. So it's not something you want to do. And I think that's true of all supplements, right? Usually when you look at supplement dosing, if you don't get enough of the nutrient in your diet, you see signs of deficiency. But if you get too much of it, you see signs of toxicity. So there really is a sweet spot that you want to be in, and that's personalized to you, not to the condition or the disease. It's personalized to your labs and your diet and your exocrine pancreatic insufficiency and your disease status.
Thank you.
Happy to help.